When I talk about treatment planning, diagnosis, I'm going to take somewhat of an unconventional approach, because for me, the best way to do this is that I can't do anything on a patient unless I have that foundation of trust. So I want to kind of walk through what's in my head. So what's in my head with this patient, I have to form a connection. Especially, let's talk about a new patient. That becomes the most classic time when they talk about, let's get some treatment planning, let's get some diagnosis. And we want to go back, and first thing I need to do is I need to form a foundation of trust with this patient. And that's done in ways, and we won't go too much into that, but you got to connect with them knee to knee. You got to make a personal connection with them. You got to kind of take down maybe any barriers which may be there, so they think you're a real person that cares about them. Now you're kind of ready to go through your routine. They've gone through a great experience with the hygienist. They see that we're in sync. They already see that, they've walked into your office. Their experience starts from the day they went on the phone. So it's also not just about treatment and diagnosis with me. They've already have a level of expectation from the first time on the phone. For the first time that they walk in, they see what this is. They understand this is a great place. There's some thought put to this. It doesn't have to be state of the art. It doesn't have to be cookies and waterfalls, but it's got to be well thought out. It's got to be a place where they walk in and the experience is somewhat seamless. So by the time we get in there and the relationship is formed, there's already been multiple relationships at different levels that have been formed. It's not just all about you, doctor. So by the time you get in there, they've already had some relationship building with your team. And then they see this kind of really cool sync with the team. So by the time that you're ready for your treatment diagnosis, I already know in my head that I go in there, I know something about the patient. I know the experience has already been very, very good with the hygienist because they're predictable in what they do. There's a consistent approach. I already know this going in, so I'm comfortable. So then I can form my relationship. Then I can reinforce what's already been done through talkovers, through reinforcing which has been done with the hygienist. And they're hearing this, and you've heard some of the hygiene talkover. So now let's talk about what's going through my head. If there's a lot of treatment to be performed, I want to key into an area that the patient leads me there. Obviously, you want to talk about, do you have any pain? Pain and comfort. They want to know, I want to know, tell me where your biggest problems are. And do you have any problems? Do you feel anything? I mean, how are things? You segue right into that because you want to get them comfortable. You want to make them feel like you care about their comfort. So that will key you into some areas to deal with first. If there's a lot of treatment that needs to be potentially performed, you want to pick out areas that are of concern to them. And then what you want to do is you want to take care of the money conversations, you want to take care of a lot of the things to get them set up so you have lots of information that's brought to the table before you give them this monster treatment plan. You got to know something about them, you got to know what their needs are, why did they come here? Now if a patient comes in there and you want to listen to them, you don't have a canned approach to this. You just don't go into your panky thing. I have nothing against panky, it's amazing stuff clinically. So my idea of treatment diagnosis is about finding out what it is, making it quite simple that you kind of grasp what it is and you do things in stage and you talk about what you want to do. We want to make sure that we want to get you comfortable first. You know what I think? If there's a lot of areas, you want to focus on one area that maybe they can accept. They don't know that you're going to do this procedure with their comfort in mind. They've never seen you do anything. They've never seen you give an injection. So you start talking about this monster treatment plan. What do you think's going on in their head? They don't know. Maybe you've got to have 6 treatments, you've got to do this, we need to do that, we need to do this, we need to do that. They're thinking, how many injections, how much money, that hurt, how much pain. You don't know what they're thinking. But what you do is you don't know what they're thinking. So you want them to think that you're not going to hurt them, that you're looking after them, you care about them. So you see what I'm talking about here? I'm not talking about the diagnosis so much as I'm talking about diagnosing their state, to get them in that foundational piece that they say, now they're willing to talk about maybe some of their needs. Keep in mind, this is a very short appointment. It's not a long monster appointment. Now, keeping in mind, you want to find out what's important to them always, and you want to give it to them. You want to make sure that you preheat this with some conversation that says, what's really important to you at this point? Where do you see yourself in a few years? What's important to you? And when they'll lead you where that needs to go. Bottom line, when you get out of there, you don't want to be spending a lot of time. You want to get them out of there to commit to some area that they believe in. That's where the visual comes in. Let's work in this area first. And I want some time to think about this. We may need to bring you back and we want to look at these other areas. What you do is once you get the urgent needs looked after, now they're ready, number one, to understand you care about them. Then you go in and you need to do this in stages, no matter what it is. And if it's a very comprehensive treatment, find an area you can get them back to experience your injection that they're going to say, I've never had an injection like that. We're going to talk about that, and we'll show you how to do that. They want to know how this wonderful thing occurs back and forth with your treatment efficiencies with your assistant. They've already experienced something that their expectation has gone up, up, up. So when you want to talk to them about high-level treatment, if they can accept it, you're looking after their money, you're looking after their financial situation, make it easy for them to pay. Treatment and diagnosis is not about fixing their teeth. That's the easy part. It's about understanding you want to look after them, and they may have needs, and they're going to bring that treatment plan in that works for them. And you know, I heard somebody say once, I have 100% treatment acceptance. Wow, how many people do you say, you need to go through your files and you want to reach this ultimate goal of 70% treatment acceptance? You do that by hammering them what's good for them, and they need this and they need that and they need to look after their health, and this is not good for their heart. Come on. You know, 100% treatment acceptance, you know what that is? You tell them what you see, you find out what works for them after you give them options, you give them what they want. 100% of the time, you're going to give them what they want in the stages that they want it. It sounds trite, but that's kind of the way I approach treatment diagnosis. Now, behind the scenes, this may sound, well, he's just a guy and he just forms a relationship. You got to know great clinical dentistry. You're going to show them all this stuff. You got to make sure that when they ask for it and when they're ready for, you're going to be showing great cosmetic stuff, implant stuff, anything that works. Your goal as a doctor clinically, I'm not diminishing the brilliance and the magic of giving great long-lasting dentistry. I'm trying to get you to a place where you can get better acceptance of treatment, where you can get those champions out there that say, this is the best thing that you're ever going to do. And that practice, they're not going anywhere else. They're going to refer all their friends and family in terms of what works for them and how they can accept it. To me, that's treatment diagnosing and that's treatment planning. And then what follows that is great treatment, whatever works for the patient.